Sophia Kanaki, and I'm going to be your student nurse from Colby Sawyer College.
Okay.
Can we just start by having you tell me your name and your date of birth?
Megan Harvey, 9/24/94.
Perfect, thank you. And do you know where you are?
Dartmouth Hitchcock.
And do you know why you're here?
For a checkup.
Great. Now I notice your bed is in the lowest position, and your two side rails would be up if they worked. We're on 10. I'm going to start by doing a head-to-toe assessment and a set of vitals.
Okay.
So, do you mind if I take your temperature?
I don't mind.
Good. Alright, this is just going to go in your ear.
Okay.
Your temperature is 98.4. Next, we'll take your blood pressure. I'm going to line this up with your arteries. For your arteries. Good. You're just going to feel a bit of a squeeze. Relocating your artery. There it is. Your blood pressure is 124/80. Do you mind if I check your pulse? You'll lay your arm across. Your pulse is 96 and your respirations are 14 per minute. This is going to go in your finger and it's going to tell me your SpO2 level, or else, in other words, the amount of oxygen you have in your blood. I feel comfortable? Oh, 100. Perfect. Now that we've done your vitals, I'm going to start on my head-to-toe assessment. I'm going to start with your head and work my way down. At any point, if you feel any discomfort or you want to take a break, just let me know. Sound good?
Sounds good.
Alright, so first I'm going to check with your scalp. and look for any bumps, bruises, lesions, bleeding, lice, dryness, to make sure just that your scalp's intact and healthy. Looks good. Do you mind lifting up your head? Perfect. Scalp looks good, healthy, no signs of injury. Hair's good, healthy, soft, feels clean.
Good.
Alright, so do you mind just lifting your eyebrows up for me? Good, thank you. Just work my way down. I'm just going to take a look at your ears. Making sure there's no skin breakdown behind the ears, no redness, no discharge, no bleeding, no bruises. And the other side, both look normal. How do they feel? Any tenderness? Can you hear this?
Yep.
Can you hear this?
Yep.
I'm going to whisper a number to you. Can you repeat the number?
Sure. 15.
Alright, I'm just going to come around the other side.
22.
Perfect, thank you. While I'm over here, I'm just going to hold up a few fingers. Do you mind covering your left eye for me? How many fingers am I holding?
3.
And cover up your right eye? How many fingers am I holding?
1.
Good, thank you. Sorry about that. So when I held my fingers up, I was checking your optic nerve. That's your second nerve. I'm now going to check your first nerve. So do you mind closing your eyes for me? What do you smell?
Alcohol.
Okay, good, thank you. Do you feel anything?
Cold and wet.
Good. Do you feel anything?
Cold and wet.
Perfect. Alright, so now I'm going to check your third, fourth, and sixth optic nerve. Do you mind following this pen light for me without moving your head? And come in close. Good, thank you. Your movement was bilateral, no nystagmus, no signs of abnormalities, that you were able to follow the pen light. Next, I'm going to continue with third, fourth, and sixth optic nerve by checking your pupil dilation. So you're going to just see a little bit of light. Good. Constriction is bilateral and looks normal. Next, I'm noting that your nose is midline. Looks normal, no redness. Any tenderness? Any tenderness throughout your face? No? Good. Your skin tone looks proper to ethnicity. And then I'm going to, okay, so when I whispered into your ears, that was checking your eighth optic nerve, okay?
Okay.
So if you can close your eyes for me and tell me when I'm touching your face.
No.
Good. And I'm going to continue down and tell me when I'm touching you.
No. 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 No.
Good. I'm now going to check your 5th, 7th, and 11th optic nerves,
Okay.
which started with if you could feel the cotton ball. If you can just push your head against my hand. Again. Shrug your shoulders. Good. Now I've done that, I'm just going to take a look into your mouth.
Okay.
This is also going to be checking your 9th, 10th, and 12th optic nerve. So can you stick your tongue out and say ah? Good, thank you. So I noticed that your tongue protrusion is midline and that your uvula contracts symmetrically. So that's good. Can you smile for me? And can you puff your cheeks? And raise your eyebrows again? Good, thank you. And if you can open your mouth one more time. I'm just checking for the mucosa and make sure your tonsils look normal. Lift up your tongue. Your teeth. Gum lines, everything looks good.
Good.
Alright, now that I've done your optic nerves, I'm just going to continue my assessment working down your body. So I'm going to start by feeling your trachea, midline, I'm feeling for your carotid pulses. 2 plus. And 2 plus. I'm now going to auscultate. So that's normal. And if you can turn your head to the side for me, I'm just checking for any jugular vein distension. On the other side, no jugular vein distension. Now I'm going to check your arms. I'm just going to feel down them for any edema or swelling. Any tenderness? On this side? No edema, no redness, no tenderness. Capillary refill is less than 3 seconds. Capillary refill is less than 3 seconds. Turn your hand over for me. Thank you. I'm going to check the brachial pulse. 2 plus. Radial. 2 plus. Ulnar. 2 plus. I'm going to place an object into your hand. And can you tell me what that object is with your eyes closed?
Yeah. Toothpick.
Perfect. Thank you. I'm going to place another object in your hand. In your other hand. You can tell me what it is.
Toothpick again?
Yeah. Good job. Trick question. You can open your eyes if you'd like. If you can take your fingers and touch them each to your thumb. Good, thank you. And if you can take your finger, you're going to touch it to your nose, and then you're going to touch it right back to my finger. With your other hand. Good. And then I want you to do rapid alternating movements with your hands. So you can put them on your thighs, and then flip them, and flip them back quickly. Good. Bilateral equal, looks good. So then what I'm going to do is I'm going to draw a number in your hand and ask you to tell me what that number is.
6.
Good.
1.
Perfect. I'm then going to check your pulses on your other side. Radial is 2 plus. Radial is 2 plus. And ulnar is 2 plus. I'm going to check your tactile firmitus, which looks good. Nope, not your tactile firmitus. I'm so sorry. That's something else. I'm going to check your turgor of your skin, and it looks normal. If you're older, I'd do it on your chest, but you're a little youngin', so I can do it on your hand.
Okay.
Next, I'm going to work my way down and start with your chest assessment. I'm going to do it by first inspecting, palpating, and percussing.
Okay.
So if you don't mind, I'm just going to unbutton this a little bit. Good. So I'm just going to palpate, and I'm looking as I'm palpating, noticing that the skin color is normal. I'm not feeling any lumps, bumps, or bruising. There's no redness, no discoloration of the skin. Everything looks good. I'm then going to percuss for normal lung sounds. And as I percuss, I'm moving my hands bilaterally to check for evenness. And to simultaneously check for any abnormal lung sounds, bumps, lumps, or bruising. So you can hear the dullness where your liver starts and where your lung ends. Now I'm going to auscultate your respiratory sounds. Or your cardiac sounds we'll start with. So I'm going to go ape to man, starting here with the diaphragm of my stethoscope. I'm now just going to identify S1 and S2 at the mitral. S1, S2 identified, no abnormal heart sounds, no murmurs, and no extra heart sounds. Now that I've done it with the diaphragm, I'm going to listen again, but with the bell this time. Not the bell, the bell. You can laugh at any time. Good. Again, heart sounds sound normal, no abnormal heart sounds, no murmurs, sounds even, regular, and S1 and S2 sound perfect. So if you can just sit up for me, I'm going to do your respiratory assessment. I'm going to start with having you take deep breaths in and out for me, and I'm going to be listening again with the stethoscope on your anterior side. So if you take a deep breath in for me. Again. I'm going bilaterally to check for even heart sound. Even lung sounds. Again. Good, thank you. Are you feeling any shortness of breath?
No.
Now I'm going to move to your back, and I'm going to do the same thing I did earlier, where I'm going to inspect it, percuss it, and palpate it and percuss it. So I'm noticing there's no abnormal coloring, your skin looks healthy, it looks dry, no discoloration, and as I percuss, I'm going to be palpating at the same time, running my hand across your back, just feeling for any lumps, bumps, that sort of thing. Let me know if you feel any tenderness. I'm just percussing until I feel, or hear the end of your lung. Sounds good. Now I'm going to auscultate. Again, if you feel any shortness of breath, just let me know and we can take a break.
Okay.
Deep breath in. Again. Sorry. Good. Lung sounds sound clear in all fields and all lobes. Can you say 99 for me?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
Alright. Lean back a little bit. You say 99 for me?
99. 99. 99. 99.
Perfect. Vibrations are even throughout. And can you take a deep breath in? Now, perfect. And then I'm going to do the same thing in the front. Again? Perfect, thank you. Your lung expansion is symmetrical. You're just going to feel a little tap on your back, and I want you to let me know if you feel any sharp pain or discomfort, okay? No? Good. I was just checking for any kidney inflammation, injury, that sort of thing. Feel good? Perfect. Good. Raise this back up. That makes you more comfortable. Thank you. So next I'm going to start by doing an abdominal assessment. Sound good? Alright, I'm going to lift up your Johnny a little bit. Let me know if you get cold. So first I'm going to start by noting that your skin tone is normal and even. Your abdomen is flat, no distension. I can visualize your apical pulse. running through your belly. And next I'm going to auscultate your vowel sounds. Right, your vowel sounds are normal. And even throughout all fields. Next I'm going to percuss. I'm just moving in a zigzag. Then I'm going to start with some light palpation. Let me know if you have any discomfort. And some deep palpation. No lumps, bumps, bruises, or masses. Any pain? No rebound tenderness. Your umbilicus is midline. Everything looks good. So next I'm going to move down your legs. I'm feeling for any tenderness or swelling. That hurt? No? No redness. Skin tone looks normal. You have some scars, perhaps any surgery. Yep. Next I'm going to feel for your popliteal pulse. 2+. On the other side. 2+. Next, your posterior tibial. 2+. And 2+. Two plus. And 2+. Checking for your capillary refill. Less than 3 seconds. Checking for your skin breakdown. Looks good, no redness. It blanches. So what I'm just going to have you do is take your feet. And you push on my hands like a pedal and pull back. Good. I'm just checking. Can you push up on my hand? Good. And push up. 5 and 5. Push up on my hand. 5. And push up on my hand. 5. Good. Can you squeeze my fingers? Even and strong. And what I want you to do is you lift your leg up and bend your knee. One at a time. Good. Perfect. And the next one. I'm just checking to make sure you have full range of motion. Can you move your ankles for me? And your toes? Good. And your arms, can you lift above to the side? You move your wrists. And you moved your fingers for me earlier, so I won't make you do that again. Okay, looks good. Are you feeling any discomfort? Is there anything I can do for you? All right, I guess we're done. Have a great day.
Thank you.